Namaskar. This is Dr. Hema Divakar, a senior OBGYN and director of the Divakar Specialty Hospital from Bengaluru, trying to respond to some of the questions, many of the questions raised around the issue of cervical cancer. Well, in this case, we have reasonably a good amount of answers in response to plenty of questions raised by each one or any one of you. First thing is cervical cancer common in India? The answer is yes, because we have women in India dying out of the diagnosis of cervical cancer in advanced stage every 5 minutes. But what is cervix and why are women affected with that? Well, cervix is a part of the womb or the uterus. The neck of the uterus is called the cervix. And how does it get the cancer? Just like polio is caused by the polio virus, COVID is caused by the coronavirus, the cervical cancer is caused by a virus called the HPV virus. So who can get it? Just about anybody can get it who is sexually active. And the virus goes and lodges into the cervix, stays there silently for about 5 to 10 years, slowly and steadily starts transforming the cells of the cervix, brings about the precancerous changes, and over the years it leads into a dreadful disease called the cervical cancer, ultimately ending in the death of the women. Can we do something to detect this cancer early? Yes, certainly, because I told you that it causes the changes in the cells. Either you can do an HPV testing to check whether the cancer-causing HPV viruses are detected or not detected, and also the age-old pap smear, which is the study of the cells of the cervix to see if the cells are normal or have they already undergone the precancerous or cancerous changes. But as we all know, prevention is better than cure. Is there any way that we could have prevented all of these dreadful happenings? Yes, luckily the answer is yes. The scientific world has made a breakthrough. There is a vaccine against the HPV virus, and therefore any girl between the age of 9 to 14, even if she takes a single dose of the vaccine, the HPV cancer-causing virus cannot enter her body, and it is a great way of prevention. What about those who are more than 14 years of age? Well, the next bracket is 14 to 25 years, where 2 doses would be required as per the recent recommendations. And right until the age of 45 years, the 3-dose coverage, the 0 dose, the 2-month dose, and the 6-month dose is a strongest method that we can have for prevention. Just imagine in another 30 to 50 years, if every girl, every woman, and also the men are vaccinated, then there'll be no HPV virus and no cervical cancer. Well, screen the mother, vaccinate the daughter. Cervical cancer, kill it before it kills you. That is the mantra, and we want you to take home a very serious message that cervical cancer can happen to anybody. It can be detected early. It can be prevented by vaccination. So wake up and do the needful from awareness to action right now. Thank you very much.